Giardiasis is an intestinal infection that affects millions of people around the world. Today, we'll learn what this condition is and why it's important to understand. Giardiasis is caused by a microscopic parasite called Giardia duodenalis. This tiny organism is so small that you need a microscope to see it. Here's what it looks like magnified many times. This parasite specifically targets your intestines, which are part of your digestive system. When Giardia gets into your intestines, it can cause problems with digestion and make you feel quite unwell. Giardiasis is one of the most common intestinal infections in the world. It affects millions of people globally and is a leading cause of diarrheal disease, especially in areas with poor sanitation. Think of Giardiasis as a microscopic bug that gets into your digestive system and makes your tummy very unhappy. While you can't see it without a microscope, its effects on your body are definitely noticeable. Now that we understand what Giardiasis is, we can explore how this tiny parasite spreads and affects people around the world. Remember, knowledge is the first step in prevention and treatment. Giardia spreads through what scientists call the fecal-oral route. This might sound complicated, but it's actually a simple concept that explains how this parasite travels from one person to another. The fecal-oral route means that Giardia parasites present in the feces of an infected person or animal somehow make their way into another person's mouth. Let me show you how this happens, step by step. First, an infected person's feces contains millions of Giardia parasites. These microscopic organisms are invisible to the naked eye, but are very much present. Next, someone comes into contact with these contaminated materials. This often happens when people don't wash their hands properly after using the restroom. Those contaminated hands then touch food during preparation or eating. The parasites transfer from the hands to the food, creating a contaminated meal. Finally, when someone eats that contaminated food, the Giardia parasites enter their digestive system and a new infection begins. This completes the fecal-oral transmission cycle. The key takeaway is that the fecal-oral route describes a very preventable form of transmission. By understanding how Giardia travels from infected feces to our mouths, we can take simple steps to protect ourselves. The most important thing to remember is that proper hand washing can break this transmission cycle and keep you safe from Giardia infection. There are 5 main ways that Giardiasis spreads from person to person or from contaminated sources to humans. Understanding these transmission routes helps us stay protected. The first and most common way to get Giardiasis is through contaminated water. This includes both drinking contaminated water and swimming in contaminated lakes, rivers, or pools. Giardia cysts can survive for months in cold water. Drinking untreated water from wells, lakes, or rivers is risky. Even swallowing small amounts while swimming can cause infection. The second route is contaminated food. This happens when food is handled by infected people with poor hygiene or when fruits and vegetables are washed with contaminated water. Food handlers who don't wash their hands properly can spread Giardia. Raw fruits and vegetables are especially risky if they've been washed with contaminated water or handled improperly. The third route is direct person-to-person contact. This is especially common in childcare settings where children may not have perfect hygiene habits yet. When people don't wash their hands properly after using the bathroom, they can spread Giardia through direct contact. Childcare centers see frequent outbreaks for this reason. The fourth route is contact with contaminated surfaces. Door handles, toys, bathroom fixtures, and other surfaces can harbor Giardia cysts if they've been touched by infected hands. Giardia cysts can survive on surfaces for extended periods. Touching contaminated surfaces and then touching your mouth, nose, or food can lead to infection. The fifth route is through certain sexual practices, specifically anal sex. This creates direct contact with potentially infected fecal matter. Anal sex without proper protection can lead to fecal-oral transmission of Giardia. Safe sexual practices and good hygiene are important for prevention. The key takeaway is that hygiene is your best defense against all these transmission routes. Proper hand washing, safe water practices, and good personal hygiene can prevent most Giardiasis infections. The Giardia parasite is fascinating because it exists in two completely different forms, each perfectly adapted for different survival needs. The first form is called a trophozoite. This is the active feeding form of the parasite that lives and multiplies inside your small intestine. The second form is called a cyst. Think of cysts as tiny survival pods. They're incredibly tough and can survive for months outside the body in harsh conditions. These two forms work together perfectly. Trophozoites do the damage inside your intestine, while cysts ensure the parasite can spread to new hosts and survive in the environment. Certain groups of people have a higher risk of getting Giardiasis. Understanding these risk factors can help you take appropriate precautions to protect yourself and your loved ones. Children are at particularly high risk for Giardiasis, especially those in childcare settings. The infection spreads easily among young children who may not have developed good hygiene habits yet. Travelers to areas with poor sanitation are at increased risk. This includes developing countries or remote areas where water treatment and sewage systems may be inadequate. Hikers and campers who drink untreated water from natural sources like streams, lakes, or rivers face significant risk. Even crystal clear mountain water can contain Giardia cysts. Swimmers in contaminated water, including pools, lakes, or recreational water areas, can accidentally swallow water containing Giardia cysts. People with weakened immune systems, such as those with HIV, cancer patients undergoing treatment, or organ transplant recipients, are at higher risk and may experience more severe symptoms. Certain sexual practices, particularly those involving fecal-oral contact, can transmit Giardiasis. Using protection and maintaining good hygiene can reduce this risk. If you fall into any of these risk categories, be extra cautious about hygiene, water safety, and food handling. Prevention is always better than treatment when it comes to Giardiasis. When someone gets infected with Giardia, symptoms don't appear immediately. Understanding what to watch for can help you recognize this infection early. Giardiasis has an incubation period of 1 to 3 weeks. This means symptoms typically don't appear until 1 to 3 weeks after you've been infected with the parasite. Now, let's look at the common symptoms you should watch for. These symptoms can vary from person to person, but there are several key signs that are typical of Giardiasis. The most common symptom is watery diarrhea, which can be quite frequent and sometimes has a foul smell. This happens because the parasite interferes with normal digestion in your small intestine. You might also notice greasy floating stools. This occurs because Giardia can interfere with fat absorption, causing fats to pass through your system undigested. Abdominal cramps and bloating are very common. The parasite causes inflammation in your intestines, leading to pain and discomfort in your stomach area. Excessive gas or flatulence is another telltale sign. The disruption to normal digestion can cause increased gas production in your intestines. Many people experience nausea, feeling sick to their stomach. This can make eating difficult and contribute to other symptoms like loss of appetite. Loss of appetite is common as your body struggles with the infection. Food may not seem appealing, and eating might make symptoms worse. Fatigue and feeling weak are frequent complaints. Your body is using energy to fight the infection, and poor nutrient absorption can leave you feeling drained. Weight loss can occur, especially if symptoms persist. This happens because your body isn't absorbing nutrients properly, and you may be eating less due to nausea and loss of appetite. It's important to remember that not everyone experiences all of these symptoms, and the severity can vary greatly from person to person. The key takeaway is this: if you experience persistent diarrhea, stomach cramps, and fatigue lasting more than a few days, especially after potential exposure to contaminated water or food, consider seeing a healthcare provider for proper testing and diagnosis. While most people with Giardiasis experience the typical digestive symptoms, some individuals may develop less common symptoms that can be surprising or concerning. Let's explore these less common symptoms that some people may experience during a Giardia infection. Some people may experience vomiting, especially during the early stages of infection when the body is reacting to the parasite. Fever can occur in some cases, though it's not as common as with other infections. When present, it's usually mild. Skin reactions like itching, hives, or rashes can develop as the immune system responds to the infection. These allergic-type reactions are uncommon but possible. Swelling of the eyes and joints can occur as part of an inflammatory response. This happens when the body's immune system becomes overactive in fighting the infection. Blood in the stool is quite rare with Giardiasis. Unlike some other intestinal infections, Giardia typically doesn't cause bleeding in the digestive tract. Remember, everyone's body reacts differently to infections. While these symptoms are less common, they're still possible. If you experience any concerning symptoms, it's always best to consult with a healthcare provider. Not everyone infected with Giardia shows symptoms. In fact, about half of all infected people feel completely fine, yet they can still spread the parasite to others. Imagine 10 people infected with Giardia. About half of them will experience symptoms like diarrhea, stomach cramps, and nausea. But the other half feel completely normal. They have no symptoms at all, no stomach problems, no diarrhea, nothing that would tell them they're infected. This 50-50 split is what makes Giardia so tricky. Half of infected people have no idea they're carrying the parasite. Here's the problem. Even though asymptomatic people feel fine, they can still spread Giardia to others through poor hygiene. An asymptomatic person becomes a silent spreader. They feel healthy, so they go about their normal activities, work, school, social gatherings. Without knowing it, they can spread Giardia through contaminated hands, shared food, or poor bathroom hygiene. Each person they interact with becomes at risk. This is exactly why good hygiene is crucial, even when you feel perfectly healthy. You never know if you might be carrying Giardia without symptoms. Regular hand washing, proper food handling, and good bathroom hygiene protect both you and everyone around you from silent spreaders. Remember, asymptomatic Giardia infections are common and dangerous because infected people unknowingly spread the parasite while feeling completely normal. When Giardiasis persists for more than 6 weeks, it becomes chronic Giardiasis. This long-term infection can cause serious complications that affect your entire body. Chronic Giardiasis damages the intestinal lining, leading to malabsorption of essential nutrients. Your body struggles to absorb vitamins A and B12, folate, and lactose from dairy products. The physical symptoms of chronic Giardiasis can be debilitating. Patients experience significant weight loss, fatty and greasy stools that may float, and persistent fatigue that affects daily activities. In children, chronic Giardiasis is particularly concerning because it can severely impair growth and development. The malabsorption of nutrients during critical growth periods can have lasting effects on a child's physical development. Even after the infection clears, some people develop post-infectious complications. These can include irritable bowel syndrome, causing ongoing digestive issues, or chronic fatigue syndrome, leading to persistent exhaustion and other symptoms. The key takeaway is this: don't ignore persistent symptoms. If you experience ongoing digestive issues, fatigue, or weight loss for more than 6 weeks, seek medical attention immediately. Early treatment can prevent these serious long-term complications. When doctors suspect you might have Giardiasis, they need to confirm it through testing. The primary way to diagnose this infection is through stool tests. These tests examine your stool sample to look for evidence of the Giardia parasite. The lab technicians search for specific signs that indicate an active infection. The tests look for 2 main things. First, they search for Giardia cysts. These are the hardy, dormant forms of the parasite. Second, they look for Giardia antigens, proteins that the parasite produces. Often, doctors will ask for multiple stool samples collected on different days. This is because Giardia doesn't always show up in every single stool sample, even when you're infected. Testing multiple samples increases the chances of detecting the parasite if it's present. Even if 1 or 2 samples come back negative, a third sample might reveal the infection, leading to an accurate diagnosis. Remember, stool tests are the primary diagnostic tool for Giardiasis. They search for Giardia cysts and antigens in your stool, and multiple samples may be needed to ensure accurate results. When doctors suspect Giardiasis, they use stool tests to confirm the diagnosis. There are 3 main types of stool tests, each with different methods and accuracy levels. The 3 main stool tests are microscopy, antigen detection, and PCR. Each test looks for different evidence of the Giardia parasite in stool samples. Microscopy is the traditional method where lab technicians examine stool samples under a microscope. They look for Giardia cysts and trophozoites, the two forms of the parasite. However, microscopy has moderate accuracy because the parasite isn't always present in every stool sample, and it requires skilled technicians to identify the organisms correctly. Antigen detection tests look for specific Giardia proteins, called antigens, in stool samples. These tests are more accurate than microscopy because they can detect the parasite even when it's present in small amounts. The CDC considers antigen detection tests the current test of choice because of their increased sensitivity compared to microscopy. PCR, or polymerase chain reaction, is a molecular technique that detects Giardia DNA in stool samples. It's the most accurate and sensitive test available. PCR can detect even tiny amounts of Giardia genetic material, making it extremely reliable for diagnosis. When comparing the three test types, microscopy has moderate accuracy, while antigen detection and PCR tests offer much higher accuracy rates. For this reason, antigen detection tests and PCR are the preferred methods for diagnosing Giardiasis, offering doctors more reliable results for proper treatment decisions. When it comes to treating Giardiasis, there are three main medications that doctors commonly prescribe. Each has its own advantages and characteristics. The first medication is metronidazole, commonly known by the brand name Flagyl. This is a widely used antibiotic, but it can cause side effects like nausea and a metallic taste in the mouth. Unfortunately, resistance to this medication is becoming more common. The second option is tinidazole, sold under the brand name Tindamax. This medication is just as effective as metronidazole, but has some advantages. It can often be given as a single dose, and patients generally tolerate it better with fewer side effects. The third medication is nitazoxanide, known by the brand name Alenia. This medication has a special advantage because it comes in liquid form, making it an excellent choice for treating children who may have difficulty swallowing pills. It's important to know that many people with Giardiasis actually recover without any medication at all. The body's immune system can often clear the infection naturally. However, treatment helps speed up recovery and prevents spreading the infection to others. Treatment is specifically recommended for people who have symptoms to prevent spreading the infection to family members and the community, and in high-risk situations such as when there are pregnant women in the household. While taking medication for Giardiasis, staying properly hydrated is absolutely essential. Your body needs extra fluids to help fight the infection and replace what's lost through diarrhea. After a Giardia infection, many people develop temporary lactose intolerance. This happens because the infection can damage the lining of your small intestine, where lactase enzyme is produced. If your symptoms persist for longer than 6 weeks, it's important to see your doctor again. This could indicate that the treatment isn't working or that you may have developed complications. Finally, it's important to be aware that drug resistance is becoming a growing concern with Giardia treatment. This means some medications may not work as effectively as they used to, making proper diagnosis and treatment even more important. When you're pregnant and diagnosed with Giardiasis, treatment requires special consideration. The safety of both you and your developing baby is the top priority. Treatment timing is crucial during pregnancy. The first trimester is when your baby's organs are developing, making this period particularly sensitive to medications. For this reason, doctors often recommend delaying Giardiasis treatment until after the first trimester, when it's safer to use medications. Every pregnancy is unique, so it's essential to discuss treatment options with your healthcare provider. They will weigh the risks and benefits based on your specific situation. Your doctor will consider several factors: the severity of your symptoms, the stage of pregnancy, and the safest medication options available. The goal is protecting both you and your baby. Remember, if you're pregnant and have Giardiasis, don't try to treat it yourself. Work closely with your healthcare team to determine the safest approach for both you and your developing baby. Hand washing is your most powerful weapon against Giardiasis. This simple habit can prevent the vast majority of infections by breaking the transmission cycle before the parasite reaches your mouth. Proper hand washing with soap and water physically removes Giardia cysts from your hands. The soap breaks down the protective barriers around the parasites, while the scrubbing action washes them away. There are 4 critical times when hand washing becomes absolutely essential: after using the toilet, after changing diapers, before eating or preparing food, and after touching animals. These are high-risk moments when Giardia cysts are most likely to be on your hands. Follow these 5 simple steps for effective hand washing. Wet your hands, apply soap, scrub for at least 20 seconds. That's about the time it takes to sing Happy Birthday twice. Then rinse thoroughly and dry with a clean towel. Hand washing works because soap disrupts the protective coating of Giardia cysts, making them vulnerable. The mechanical action of scrubbing physically dislodges the parasites, and running water washes them down the drain. This simple combination is incredibly effective at breaking the infection cycle. The key to prevention is making hand washing an automatic habit. Set reminders until it becomes second nature. Keep soap easily accessible. Teach proper technique to children, and lead by example. Remember, this simple habit is your most effective defense against Giardiasis and many other infections. Water safety is crucial for preventing Giardiasis. Giardia cysts can survive for months in cold water, making contaminated water sources a major risk. Here are the essential water practices everyone should know. First, swimming safety. Natural water sources like lakes, rivers, and even some pools can contain Giardia cysts. These microscopic parasites can survive in water for months, especially in cold conditions. Always avoid swallowing water while swimming. Even a small amount of contaminated water can contain enough cysts to cause infection. Keep your mouth closed underwater and teach children this important safety rule. Boiling is the most reliable way to kill Giardia cysts in water from natural sources. When you collect water from lakes, rivers, or streams, always boil it before drinking. Bring the water to a rolling boil at 100 degrees Celsius or 212 degrees Fahrenheit. Maintain the boil for at least 1 full minute. This temperature and time combination will destroy all Giardia cysts and make the water safe to drink. Water filtering is another effective method for removing Giardia cysts. Use a filter with pores smaller than 1 micron, ideally 0.1 microns or smaller, as Giardia cysts are typically 8 to 12 microns in size. The filter physically blocks the cysts from passing through. Water flows through multiple filtration layers, removing parasites, bacteria, and other contaminants to produce safe drinking water. Don't forget about water used for brushing teeth. In areas where Giardiasis is common, use only safe water for oral hygiene. Even small amounts of contaminated water in your mouth can lead to infection. Use boiled, filtered, or bottled water for brushing teeth, especially when traveling or in areas with questionable water quality. This simple precaution can prevent accidental ingestion of Giardia cysts. Remember the golden rule: when in doubt, boil it. These simple water safety practices are your best defense against Giardiasis. Whether swimming, drinking from natural sources, filtering water, or brushing teeth, always prioritize water safety to protect yourself and your family. Food safety and hygiene practices are essential barriers against Giardiasis infection. 2 key areas require our attention: proper food handling and maintaining clean bathroom facilities. Fresh fruits and vegetables can harbor Giardia cysts on their surfaces, especially if they've been contaminated by infected water or poor handling practices. Thorough washing with clean water removes these dangerous cysts. Scrub firm produce with a clean brush and rinse all fruits and vegetables under running water, even those you plan to peel. Bathroom hygiene is equally critical. Giardia spreads through the fecal-oral route, making contaminated bathroom surfaces a significant risk factor for transmission. Regular cleaning and disinfection of bathroom surfaces breaks the chain of transmission. Focus on high-touch areas like toilet handles, faucets, doorknobs, and light switches. Use disinfectants that are effective against parasites. Clean surfaces daily and immediately after any illness in the household. This simple routine dramatically reduces your family's risk of infection. Remember these key practices. Wash all produce thoroughly under running water. Clean bathroom surfaces daily with effective disinfectants and maintain these habits consistently. These simple steps create powerful protection against giardiasis. Sexual contact can be a route of giardiasis transmission, though this pathway is often overlooked in health discussions. Understanding these risks helps protect both you and your partner. Giardia parasites present in fecal matter can be transmitted when there is direct or indirect contact between the anal area and the mouth during sexual activities. This creates a pathway for the parasite to enter the digestive system. Several practical strategies can significantly reduce the risk of giardiasis transmission during sexual contact. These approaches focus on hygiene, protection, and communication between partners. Remember that while sexual transmission of giardiasis is possible, it is entirely preventable with proper precautions. Good hygiene practices, protective measures, and open communication with partners are your best defenses. When in doubt, consult with healthcare professionals for personalized advice. When traveling to areas where giardia is common, taking the right precautions can protect you from this intestinal infection. Smart travelers follow specific guidelines to stay healthy abroad. The golden rule of travel health is simple to remember. Boil it, cook it, peel it, or forget it. This motto covers the 4 safe ways to consume food and drinks when traveling. For drinking water, stick to bottled water from sealed containers or water that has been properly boiled. Avoid tap water and ice cubes, as they may be made from contaminated local water sources. For food, choose items that are served hot and freshly cooked, fruits that you can peel yourself, or foods from sealed packages. Be cautious with raw salads, street vendor food, and raw seafood, as these may be washed or prepared with contaminated water. Remember these key travel precautions. Drink only bottled or boiled water. Say no to ice in drinks. Choose hot, freshly cooked foods, and peel fruits yourself when possible. Following these simple rules will significantly reduce your risk of Giardia infection while traveling. Drug resistance has become one of the most significant challenges in treating giardiasis. Traditional medications that once worked effectively are becoming less reliable as the Giardia parasite develops resistance. To understand drug resistance, imagine medications as keys trying to unlock and destroy the parasite. Over time, the parasite changes its locks, making the old keys less effective. Now, the same medication faces a resistant parasite. The drug can no longer effectively eliminate the infection, leading to treatment failures and persistent symptoms. Scientists around the world are working hard to understand exactly how Giardia develops resistance. They study the parasite's genetic makeup and cellular mechanisms to identify weak points. This research has led to promising developments. Scientists are creating new medications with different mechanisms of action that can overcome existing resistance patterns. The fight against drug resistance requires a multi-pronged approach. Researchers are also developing combination therapies and exploring ways to prevent resistance from developing in the first place. These research efforts give us hope for the future. While drug resistance remains a serious challenge, the scientific community is actively working to stay one step ahead of this adaptable parasite. Scientists are revolutionizing giardiasis research using cutting-edge genome technologies. These advanced tools allow researchers to decode the complete DNA blueprint of the Giardia parasite. By understanding the parasite's genetic code, researchers can identify specific proteins and pathways that are essential for Giardia's survival. These become potential targets for new, more effective medications. Scientists are also studying how Giardia interacts with human cells. Understanding these interactions helps researchers develop better treatments and explains why some people get sicker than others. Perhaps most exciting is the research into immune responses against Giardia. Scientists have identified key immune molecules like interleukin-17 that help fight the infection. This knowledge is paving the way for potential vaccines that could prevent giardiasis altogether. Your gut is home to trillions of bacteria called the microbiota. This diverse community of microorganisms plays a crucial role in digestion, immunity, and overall health. When Giardia parasites infect the intestine, they don't just cause direct damage. Research shows that these parasites significantly disrupt the delicate balance of your gut microbiota. The parasites alter the gut environment, causing some beneficial bacteria to die off while allowing harmful bacteria to multiply. This creates an imbalanced ecosystem called dysbiosis. This microbiota imbalance contributes to many of the symptoms we see in Giardiasis. The disrupted bacterial community can't properly digest food, leading to diarrhea, bloating, gas, and poor nutrient absorption. Even after the Giardia infection clears, the disrupted microbiota can lead to long-term complications. Some people develop irritable bowel syndrome, chronic fatigue, or ongoing digestive problems that can last for months. Supporting your microbiota during and after treatment is important for recovery. Probiotics, a balanced diet rich in fiber, and avoiding unnecessary antibiotics can help restore the healthy bacterial community in your gut. Understanding the connection between Giardia and your gut microbiota helps explain why some people experience prolonged symptoms and emphasizes the importance of supporting your digestive health during recovery. Giardiasis holds a concerning status in global health. The World Health Organization has classified it as a neglected disease, meaning it receives insufficient attention and resources despite affecting millions worldwide. The global impact of Giardiasis varies dramatically between regions. In developed countries, infection rates reach about 7% of the population. However, in developing countries, this number jumps to a staggering 30%. Children bear the heaviest burden of Giardiasis worldwide. The infection significantly impairs their growth and development, creating lasting effects that extend far beyond the initial illness. The economic consequences of Giardiasis in developing countries are profound. When children suffer from chronic infections, their reduced productivity as adults creates a cycle that hampers economic growth and development. Breaking this cycle requires a global commitment to awareness and prevention. Education about proper hygiene, access to clean water, and improved sanitation can dramatically reduce Giardiasis transmission and its devastating effects.